Being heartbroken can affect you not only mentally and emotionally, but physically too. Though it is also possible to die from a heartbreak, there is a medical condition that harms your heart. 2% of people who are seen with a suspected heart attack are then diagnosed with broken heart syndrome. And no, it is not only caused by being broken up with or hurt from a relationship. This brings me to my topic of my speech, Takotsubo cardiomyopathy, also known as broken heart syndrome. It can be important to have knowledge on medical conditions and what to do about it for in case you happen to get it in the future or you know someone who has it, or just simply for the fact of, who knows, maybe someone on the street randomly asks you about it. But the purpose of my speech is to inform and teach you about Takotsubo cardiomyopathy. However, I will refer to it as broken heart syndrome because that is a lot easier to pronounce and say. As you can tell, I'm already kind of struggling with it. So that's how I will refer to it as from now on. To do so, we will go over what the syndrome is, go into depth about what happens during it and how it affects or could affect someone, and lastly, how to recover and what treatments there are. Now, what is broken heart syndrome? It's a temporary heart condition that occurs in response to an intense or traumatic emotional or physical experience. This causes a weakening in the left ventricle, which is the heart's main pumping chamber. Due to this, it affects the heart's ability to pump blood properly and effectively, which of course causes a reaction. Moving on to the next question. What are the symptoms and what could cause it? Symptoms include sudden chest pain, shortness of breath, fainting, and electrocardiogram abnormalities that mimic those of a heart attack. Though it is easy to mistaken it for a heart attack, for this syndrome leaves no evidence of coronary artery obstruction. Sorry, struggling with that a little bit. This condition is usually caused by intense experiences such as severe pain, intense fear, sudden surprises, an unexpected loss or injury, severe illness, or medical procedures, and etc. Doctors believe that sudden stress hormones primarily stun the heart temporarily. And it has also been researched that broken heart syndrome cases are higher in females than males, especially after menopause. And for those of you who don't know, menopause is basically women not having periods anymore. And lastly, how do you get help and recover? Luckily, this medical condition is only temporary and people typically recover within a month. However, ways to diagnose and test for this are through blood tests, EGG tests, an echocardiogram, or a coronary angiogram. For treatments, medication is the most common as it helps reduce stress and helps your heart muscles recover. Only 20% have heart failure, but luckily most patients fully recover by 2 months due to heart muscle taking about only 2 to 4 weeks to heal. And of course, try to manage any big emotional or physical experiences to the best of your ability to help prevent this from happening to you or even just people that you know too. In conclusion, in the last few minutes, I addressed the syndrome Takotsubo cardiomyopathy, what causes it, as well as how to recover and how to prevent it in the future. Though this may not be something that helps you in college or everyday life, it is good to have knowledge on this condition for the simple fact of what if this happened to you or someone you know. Now you know how to handle this situation properly and to the best of your ability. So that was my speech on that, and thank you.